Well, thank you very much, everybody. And there are a lot of everybody's to thank for attending. Overwhelming attendance. So for some of you, if your colleagues can't get in because the room is full, please tell them that they will get a recording of the session in 24 to 48 hours. And we are going to definitely make sure that we have room for everybody. We're full at 500 for this one, but we have over 1,000 registered. So thank you all very much. Very excited about this expert panel series that we're going to be doing for India. We've been doing a number of them around the world, 4 so far in North America, 3 in Europe, 2 in Latin America. But we've also had a lot of people from India attending the ones from Europe. So we thought we'd just put one on for the Middle East, India, and Asia. And as I said before, thank you very much, everybody. The attendance and the support has been really good. And I think part of it is due to the panelists that we have here. We're going to be talking about complacency and COVID, but we're also going to open it up a bit too, so that they can also talk. Shankar can talk a bit about what's happening in Australia and the Middle East. And Dr. Pravina and Prabhakar can certainly talk about what's happening in India. And Dr. Wada is trying to get on from Dubai, but just having a few technical issues. So hopefully he'll be able to join us. But just before we go too much further, Mr. Shankar is with Sterling Wilson. He spent a lot of time in the Middle East and in India. He is currently in Australia right now. If you can see the, he's got the perfect Australia background for us there. Dr. Pravina Dorothy is with JLL, and she is the lead safety person for West Asia, and I'll let her tell you a bit about JLL, but I did have the privilege of presenting to her group, about 80 people in Bangalore, just pretty much just before they shut the world down, eh, Dr. Pravina? It was about a week or two before it all started getting really dicey for
Just
traveling
3 weeks
around.
before the lockdown.
Yeah. And we also have Mr. Prabhakar Kale from Tata Power. And I've met I've met all of these people personally. And the whole purpose of these webinars originally was so that you could all hear from the people who actually have to make the difficult decisions, like difficult questions, difficult decisions. But should it be zero harm or not? I mean, you can go to a conference and listen to people give advice, but somebody's actually got to make a decision. We know some leading indicators are more reliable than others, but what ones are actually reliable enough that you'd change the course of the ship, or that you would go inform senior management about operations or personnel? I mean, which ones do you believe in enough to actually do something like that? And we also wanted to talk about, leadership, and how important is felt leadership or not, right? I mean, I think it makes perfect sense, and yet, how come mothers and fathers can't keep their kids from getting hurt? They certainly care as much as anybody could possibly want. So difficult questions that people who actually have to live with the answers, that was what this was originally going to be all about. But once the COVID crisis hit, obviously everybody really wanted to know, what are the leading companies doing with COVID, and that way they could know whether what they were doing either compared, or maybe they didn't like what they were doing, but at least they would know what leading safety professionals and leading companies were doing. So hopefully we'll be able to get at some of those issues that have been around for a long time. But right now, in terms of just dealing with the crisis at hand, and it's been going on for a while, Mr. Prabhakar, maybe if you could start us off, because electricity is an invisible hazard. So you've got some folks who are obviously sort of used to that aspect of safety, dealing with an invisible hazard, although COVID's a fair bit different in terms of its transmission ability. But they're obviously not the only folks who work at Tata Power. So How first of all, has it been going with the folks who deal with the electricity? And then what about all the rest of the folks? And maybe since you operate all over India, just give us for those of us around the world, just a bit of a bird's eye view of what's happening in India first.
Yeah, thanks, Larry. Thanks for, first of all, giving me this opportunity to interact with such a large audience, that to cross across the geographies. Let me talk about India. Yes, as you rightly said, Tata Power is present in almost about 16, 17 states in India. Northeast, northeast, west, south, everywhere. So this, this pandemic has had different impacts over Tata Power operations all over India in different geographies also. As you rightly said, we have been already dealing with this invisible hazard, that is electricity, and that we have been dealing with for more than 100 years now. And that has maybe, that has been giving us an advantage also, because we are already used to it, right? Especially handling invisible hazard. Yeah. Unfortunately, majority of our operations have been into the, from COVID perspective, into the hotspot areas like Mumbai, Delhi, even Bangalore has been a hotspot once upon a time. Now, though the situation has normalized now, right? And our approaches have been different for the different locations. Now, since we have been already used to, especially our core staff, the core operations and management staff, they have been already used to handle any kind of emergency. It's like, the frontline army, ready to take on any eventualities at any time, 24/7 prepared, right? So same approach we have been using even in dealing with COVID-19 also. So if you look at our operations and management people, they have been able to handle it very nicely. We have had very few cases of COVID-19 from the core staff. Okay, but yes, when it comes to the non-core staff as well as the support staff, I mean canteen, housekeeping, transport, security, all those they are critical, but they are support staff, right? I would say critical support staff. Now, for them to handle this situation is something unusual. They were never prepared for. So now, it was our responsibility to make them ready to face any kind of situation. And thanks to our top management also, it started with, setting up an apex response committee followed by emergency response teams at each of the locations, and then a wide communication, right from the top, like starting with our CEO and MD, and then our CHRO, then corporate communications and corporate safety and environment. We have had, a number of communications going out to the employees, reaching out to the employees. We invoked, as soon as we realized this is, this is going to stay for long. So we invoked our business continuity and disaster management plans. Accordingly, emergency response teams were formed at each of the locations, and they started doing the desktop tabletop exercises also.
Right. Okay.
And mock exercises also. So like that, we started our preparations, and technology. In fact, the technology has been playing a great role. It has been helping us a lot in dealing with this pandemic as of now.
Okay. Oh, well, Prabhakar, thanks very much. So first of all, the invisible, like the people used to the electricity, it wasn't that big a deal for them to move to deal with this one, but a few challenges certainly with the administration, finance, and the critical support staff, like you said. But you also got some help from the leadership group. They stepped up a bit in terms of the communication. So excellent. Wada, Dr. Wada, great. You made it. Can you hear me okay? So far, so good?
Yes, I can hear. Can you hear me?
Yes, we can. Excellent. Okay. Well, let me, just before I come to you, Dr. Wada, let me, I'll introduce everybody, by the way. Dr. Wada is with Enoch, Emirates National Oil Company, and I've I first met Dr. Wada speaking at a conference in Berlin, and then he was the moderator for an expert panel that I was on at the GAIL conference, Gas Association India Limited in New Delhi. And then we were also speaking together at a conference in Kuwait. And thank you very much for being able to make it, Dr. Wada. I know sometimes the technology is a little iffy. Mr. Shankar, let me, if I can, just you've worked in in the Middle East a lot and in India, and now you're in Australia. I'm not asking you to be, if you will, the overriding authority on the Middle East through to Australia, but how overall is everything comparing, just as you would see it from the 40,000-foot view? And then maybe if you could just tell us a bit about how it's going in Australia, and whether or not you guys are winning the war against complacency.
Yes. Thanks, Larry. It's been a pleasure connecting with the panel. Good to have the Middle East on board. So my journey began this year in India, went on to the Middle East, Dubai in February, and since then I've been in Australia. So I've been, as you were, leading the pandemic in various ways. I am from Sterling Wilson Solar. It's a Shapoorji Pallonji Group company. It's a global pure play, end-to-end solar engineering, procurement, and construction solution provider into the renewable sector. We are a global company. We got office in 25 countries and projects in 18. And as we speak, we had a couple of false starts. We had an employee came into the office in Mumbai who was connected, if not infected, to the person who had COVID. And the last 2 months has been relatively fair, although recently we had in Chile a couple of cases infecting the people. So you can say the spread of the pandemic has been fairly sporadic. Although the pandemic per se has been playing to tunes, if you're aware, there's a cyclical periodicity in the COVID, from the plague in 1720 to the cholera outbreak in 1820 to the Spanish flu 1919, 1920. It's been something that's cyclical. Even in the last few years, there's been the Spanish, since the Spanish flu, we had the Asian flu, we had the Hong Kong flu, and we also had the H1N1. So we've made preparations. A lot of corporates globally have also, and countries have prepared for the pandemic in some ways. Having said that, as Prabhakar said, we all have our pandemic response plans in place, but when it comes to the rubber actually hitting the road, I'm sure most of us have been found wanting. Some geographies like India has done pretty well with a complete lockdown, but once the lockdown eases, you can see that there's been a sporadic increase with the number of cases that's going up, and it's difficult to control. Likewise, in the Middle East, a very regulated industry. The global economy depends on tourism, and I'm sure Dr. Wada will speak about it. Also, it's been an interesting challenge, an interesting difference in the way the COVID has played out. Australia has been very different in the way the people are, and in the developing and the developed countries of the way you would actually implement a lockdown and take the precautions. Having said that, Australia and New Zealand has done pretty well for itself. As we speak, they're opening up. There is the economy is opened up. The office opened up this week, so we're back to work. The project sites were functional. There was precautions taken. There was all the social distancing starting from the pre-starts, designated places in offices, public transports, all of that in place. In a way, it was very controlled. So you can say that in a way, nothing, it's not over until it's over, but we are in a definitely better place as we speak in Australia.
Okay, all right, well, excellent. I mean, we're the province that I live in, Canada, British Columbia, Western Canada, is done very, very well. But I think it, more good luck than good management necessarily. But one of the things that one of David Bianca from Epiroc, and I was hoping he might actually be able to join us because they have some operations in India as well too. And I've been at one of them, but he said there's sort of two levels to this. There's the surface level that we all have to comply with, if you will. But he said there's also the deeper level, which is what do you do when nobody's, how long do you wash your hands when nobody's washing? And if he thinks if we don't win the war at the deeper level, that it's just going to keep rebounding and rebounding. And Anthony Panapinto, who is the epidemiologist expert for Procter & Gamble, and he's on the expert panel in North America. And just to your point, Mr. Shankar, he said, there's going to be another pandemic in 5 to 10 years. He said probably closer to 5 than 10. And we've got plans in place. But just to your point, he said, when it actually hits, we all find ourselves a bit a bit wanting. And sorry, Dr. Wada, come back to you. How all is it going in the Middle East now? I know you and I talk offline a fair bit and stuff. So you've told me a bit, but for the rest of the folks, especially out in the Philippines and out in Australia, they're probably not really knowing how well things or not well things are going in the Middle East. And then maybe just a bit more specifically how it's going for you guys at Enoch.
Well, I mean, I'll speak more generally about the maybe the UAE and what organizations are doing here. I think the situation has been managed well, as Mr. Sankar said. Because our economy depends on tourism and depends really on having people get together and bring people from all around the world. It's a business hub, etc. It's been very, very tough, I think, economically, and we don't know. It might get actually much tougher. We don't know what the recovery is going to be like. McKinsey. I read a report that they had produced about 7 weeks ago. I was actually with them on a webinar with the Board Directors Institute. And they gave scenarios, 9 scenarios of recovery economically, and the better scenarios were where government policy had sort of come in to support what was going on, and there was good medical system. So we've got relatively good medical systems here in the UAE. The issue that the government was concerned about is that if there was going to be a huge amount of people coming to the hospitals, was it going to have an impact on the carrying capacity of the things? So what's being done in organizations, back to your question, Larry, has been really driven by a framework that the government has given. So the government has been trying to encourage. So when they went through the lockdown, they told people, look, let's lock down. Told businesses, lockdown, do this, do that, close the malls, close this, close that. And then when they restarted, they've been doing this in a very staggered way. I think the communication, in terms of communication, they've been very, very successful because there's been continuous communication. In fact, so much so that people were getting confused because, there was communications every 2-3 days. And as you know, in a time of crisis, good leadership is driven by good, frequent, reconfirming, empathetic communication. And that's the kind of communication we've been having here in the UAE, right from the top. I mean, right from the top leadership in the country. They've been talking to people directly, talking to the expatriates, talking to the nationals, and reconfirming to them. In terms of finally, just in terms of what we've been doing in terms of putting in good barriers, the social or as you know very well, Larry, I like to call it physical distancing, not social distancing. I don't feel like we are socially distant right now, and we've got 180 people online. I mean, this is not social distancing, is it? It's just physical distancing.
1,000 water.
Yeah. So we've been doing that. We've been, we're sitting. I'm sitting in my office. Yeah, I'm sitting in the office, but this is my mask.
Yeah.
So this is the mask, and I've got my my here. Show you. This is my hand sanitizer. Right over here. Kind of thing. So I can show you all the stuff that we've got, and I can show you
I could ship you my teenagers so you can fix them up. They're not all getting the social distancing thing here. They're making everybody go through all kinds of really a lot of protocol shenanigans for the high school graduation. And then my daughter's saying, "Can we have the party here afterwards, Dad? I only want to have like 50 people here." I'm like, "Yeah," and they'll all be 2 meters apart, I'm sure. So I don't think so.
Yeah.
Dr.
No, but you should limit it. You should limit it to 49. You should limit it to 49 because Sweden, didn't allow gatherings for more than 50 people. So as long as they're 49, you'll be all right, man.
Yeah, just what I want is 49 drunk teenagers at my house. Goodness gracious. Dr. Pravina, I know your Operation JLL, but tell everybody a bit about what JLL does and the scope of JLL worldwide. But I know that you folks have got some you're looking after so many buildings and facilities and the cleaning and everything, the chemicals, the training, the workforce. Some of it's transient, just a lot of challenges. And yet from what you've been telling me, things are actually been going pretty well. So tell us how you well, tell us a bit about JLL and then tell us a bit about how you pulled it off.
Thank you, Larry. Thanks a lot for this opportunity.
Oh,
So
you're welcome.
JLL, Jones Lang LaSalle, is a global real estate services company, Fortune 500 company. And it is basically into real estate investment and then real estate management. So corporate solutions, which is basically integrated facilities management. So we have almost 12,000 employees in India, of which almost 90% are located at different client sites. And this is spread across 30 states and union territories across the length and breadth of India.
Whoa.
And this itself is a challenge for us. We don't have all employees together under one roof or within our organization office. So there were 4 aspects which actually helped us to get through this and keep us going on. Being a global company, we had the opportunity to know about the protocols which were put in place in Wuhan and China sites well before our government brought in the guidelines. So by 3rd week of Jan, we had a global HSSC cleaning protocol, disinfection protocol in place, along with the hand hygiene protocols and all. And 25th Jan is the first mail alert went to all JLL employees in India. And we got the first guideline from our government on cleaning protocol on 29th of March. So we were way ahead of it, and we had the buffer time to prepare ourselves and start it out. And this went to the second aspect, that is the communication, wherein within couple of days of sending that mail, we understood, okay, most of the people haven't opened that mail and so on. So they have seen that mail or responded to it. So we brought in the top-down approach. It was exactly a targeted top-down approach where our leadership team understood the necessity of it, even though it was not prevalent at that point of time. In Feb, we had starting of Feb, we had only 3 cases. That too, they were actually traveling from Wuhan, directly from Wuhan, and they got well also. For the next couple of weeks, we didn't have any case. So it was, in most of our mind, it is something related to a pandemic or epidemic in China, rather than something which is going to come in India. But our leadership team understood. And as Prabhakar said, we also had a emergency response team, which was comprising of HR, our MD, our COO, and technology and admin team and all. So we were all working together, and we targeted the site account teams, and we ensured that they understood that they are responsible for implementing all the measures which are coming in. And we had series of webinars, alternative days we used to conduct webinars to ensure anyone who's having any doubt regarding COVID, what is COVID, what are the protocols, even though it is in the SharePoint available to all JLL employees across the globe. So we were there to tell them, okay, this is the thing, this is how we need to respond to a situation wherein there is a illness case. So to that level, we were prepared. And
Wow.
this actually led to being a health and safety professional, you would know about the risk reduction and elimination methods and all. So we targeted on what are the risks posed actually due to this pandemic. This was different from other pandemics which we were prepared for. So high touch surfaces. So is there a way to eliminate high touch surfaces, like whether we can have automated soap dispensing machines or automated sensor based taps and all? So those were the points which led to the fourth aspect, technological intervention. Like as Prabhakar said, we introduced application for self-help declaration, and we had remote thermal scanning systems. And then we partnered with a tech team which actually had brought in contactless entry, which will actually scan my face and then say if if I'm not wearing a mask, it won't even allow me in. So, and it will sense my temperature and all. Only when everything is perfect, it will allow me in. It will open up that door. It is integrated with the access control system.
Wow,
So
okay.
this is how we started out and have been surviving. Of course,
Wow, very
it
good.
will keep on developing.
Well, Dr. Pravina, that's a lot of stuff in a short period of time for a lot of people. I know this wasn't one of the questions, but how many languages do you, like, if you're in 30 states, do you have like 15, 16 different languages that you've got to get all this information to everybody in as well? Is that, and you did all of that in that period of time? That's really incredible.
So we had the language mode of communication is English and Hindi, and regionally, whenever we are a group of people, so whenever they want to talk to us in a regional language, so they used to approach. So that wasn't an issue because already as EHS professionals, we were well versed to handle all side issues. You will know how to implement, how much it takes to implement EHS programs across all states in India.
Yeah, well, it's a challenge, all the languages, that's for sure. We're doing our best. I think we've got 5 or 6 now, but there's more and more to come. Mr. Prabhakar, well, you were talking a bit about the leadership at your company and a bit of what they've done as well, and also maybe if you could just what technology, if any, did you guys use in terms of temperature, temperature screening or any of those sorts of things? And I was also wondering if just a bit about if you've had to do any contact tracing so far and how that's been going for you.
Thanks, Larry, again.
Yeah.
I will first talk about the leadership involvement. You know how involvement of the leadership or leading from the front makes a big impact or difference. Our CEO and MD, keeps visiting various our sites. Tata Power being into electricity business, we come under essential services. Okay, so even during this lockdown also we couldn't afford to shut our operations down. So our primary focus was on how to continue our operations and still maintain reliable supply to the consumers. That was very, very important, right? So our CEO himself visited some of the power stations, the substations, just to encourage the people over there. Okay. Then
he went there in person, actually.
Yeah, he personally visited those locations.
Okay,
Just
excellent.
to appreciate their efforts and encourage them. That gives a lot of boost to the people that if your CEO and MD is visiting your location, that too in the evenings or during odd hours and all, that shows a big difference. That is one thing. Then to sensitize the top leadership, okay, the senior leadership team at Tata Power, he himself took interest and arranged few webinars to get learn from experiences of worst hit countries like Italy and Europe, most of the European countries. He arranged a webinar with NL Foundation, okay, and he asked all of us, the top senior leadership team, to attend that webinar, and we got a lot of learnings from their experience also, because they have gone through this cycle much before India has been experiencing. So we could learn a lot from them, their experiences. That is one thing. Then when you talk about the technology, it started with entry and exit protocol, which is strictly followed at all our locations. We have a protocol which talks about temperature screening not only at the time of entry but even at the time of exit. Whoever is entering our premises, we use the contactless infrared temperature scanners, and the temperatures are scanned. Then every location we have the hand sanitizers,
Okay.
and how we keep people alert all the time, especially when we are talking about the complacency and all. The moment I log into my computer, the first thing the answer, even we have made that that questionnaire very very simple. One can fill in the physical form, one can fill in using the mobile just by scanning a QR code,
Okay.
or various options we have given, right?
So
That itself,
every day, sorry, Prabhakar, just for every
yeah,
day they
every day.
get this thing will come up and sort of ask them, how are you doing? And they have to fill out this little form. Is it got a lot of fields? I mean, you wouldn't want people to have to fill out a
No,
great big
we have,
long form.
yeah, we have kept it very simple so that people also don't feel it cumbersome to fill in the form, right?
Right.
It's only, we have 9 questions. In fact, we are now planning to reduce it to 5 or 6 only. But then the
Okay.
answer is only in the form of yes or no. Now, if any of the answers is yes, then the person is referred to either the medical officer or the concerned HR person for further investigation. Okay, for example, do you have fever, or what's your body temperature? Is it more than 99 point something, or something like that? If my answer is yes, then immediately I am referred to either my respective business HR or to the medical doctor for further course of action. And they have been given the protocols how to deal with these cases. So it
Okay.
starts like that. Then our
Well,
teams have in-house developed these automated sanitizer dispensers. Then we have put up posters all over. We have been using a lot of digitalization initiatives. That has, in fact, this pandemic has given us an opportunity to explore a lot of digital options.
okay, so posters as well too. Okay, so and temperature screenings coming in and coming out, and your leadership group actually stepped up and went out and talked to some people in person. That's excellent. That's excellent, Mr. Prabhakar. Good. I mean, I've had the privilege to speak at that one Tata conclave, and I got to meet a lot of people there. But that's great that they stepped up. Excellent. Mr. Shankar, what is Sterling Wilson doing to fight complacency? I mean, I'm not sure. In some areas, maybe COVID is still new enough that complacency isn't really a problem yet, but in some of the places where, like as you said, where it started a little bit earlier, like if you look at what's happening in China now, there's another outbreak in Beijing and I think a lockdown there, and it sort of also goes to show how fast it can go if there is an outbreak too. So what are you guys kind of doing to fight that complacency? Well, first of all, tell us where you think complacency is a problem, and then tell us what are you doing to fight it?
So Larry, if you look at a typical pandemic wave, the learnings from the millenniums, as you wish, it goes through 4 waves. It starts with, and typically one wave lasts 8 weeks, and there is a respite for 10 to 12 weeks, and then it goes through 4 waves. Perhaps in China, what you just mentioned, the Beijing is supposed to be the second wave, 150 deaths or day before yesterday. So that could be the second wave. So you got a long time coming. So one of the things we did was, this happened around a risk workshop we had with one of our major clients in Brisbane, where we looked at the risks and looked and identified pandemic as one of the major ones. That was around the time, early February, when it was just starting up. early days as you wish. And I guess understanding that the pandemic will take its time to play out, it could be different. Each different country, each different strain could be different. To understand that it is not something that goes away, and there is a cyclical way of its return. That is one thing we need to be ensuring. So if you're aware of that, that takes care of the pandemic complacence. Having said
Well,
that, through the
yeah.
guiding principles in preparation, you would always want to ensure you identify your critical business processes, and that's something a systems-driven company should do. Understand who are your critical staff, your critical assets, and ensure the continuity of that. So it's a lot about business continuity. So when you're able to manage these and you see the way the offices, our India office has been shut down since the pandemic came in, and I mentioned there's a case in a Mumbai office. Dubai has opened up a little, and Australia was fairly functional. So it's been business as usual, but it's been a phased approach. So the various timelines of even a business preparation has been through the normal operations, through the remote working, through the minimum staffing at site. We went through that and took all the controls and precautions that Prabhakar mentioned. Also the emergency service level, where we actually locked down some situations. Some projects were locked down while the operation maintenance did continue, essential services. And we actually did a safe suspension in some. So a phasing of the pandemic, and this is not just across one wave, each wave you've got to be possibly looking at these. And if you're aware of the hazards and you're looking at the precautions thereof, you'll be able to prevent complacence from seeping in.
Oh no, just sorry about that. Just we're getting lots of questions coming in from the audience here. So I'm trying to do two things at once, and I'm not doing either of them, I think, very well there. But anything in particular that you guys, Mr. Shankar, are doing to help fight complacency, where like in North America and Europe, like if you've, I don't know what news you get, but you know, when they opened up Paris, it looked like there was no such concept as social distancing. You probably saw in the news all the protests in North America. Well, they've been around the world, but and again, you know, there wasn't a lot of social distancing at a lot of the protests, right? So we got to see a lot of complacency and the effects of it maybe a bit earlier, but I'm sure you're seeing some of it in certain areas now, and I was just kind of wondering what if you can do preemptively to prepare for it.
So the guiding principle of the pandemic, Larry, is across various geographies to keep our people safe while running our businesses related to the local risk environment. It could be different, and you're aware that you mentioned US. This week we had a case in our Arizona office, our office in US. So therefore, there's been a shutdown there. Each country, each continent is different. So managing within the risk environment is also very important there. It's also important. There we see a new member in the SafeStart family behind you, your pup. Okay.
Oh, right. That's
I guess the only excuse one got in the pandemic was if you could walk your dog, and that was the one reason in Australia you could actually make a breakout, and the dog was the most popular person in the household. But that apart, across the pandemic scenario, if you look at the pyramid as a safety approach, look at the pyramid from the elimination, substitution, engineering controls, admin controls to PPE. And I guess it all started with a little bit of confusion about the PPE. A mask, is it a mandatory one for a non-health professional or not? So starting from the mask and the shield to the social or physical distancing, as Dr. Avatar mentioned, to ensure that we get that right. I guess social distancing came much closer. In fact, a lot of the teams, into the leadership, bonded extremely well during the pandemic. It's a time when people got together and rallied around like never before. The kind of connects we had, and we evolved to MS Team platforms. We got a lot of applications. We built HSC app also to get digital information and looking at focusing on the base of the pyramid, looking at more health and safety, more health issues to look at the safety observations, and looking at engineering controls, auto taps, sanitizers, auto dispensers, temperature screening, etc., fumigation, and substitution using the web apps to avoid physical contact, to elimination, working from home, which could be the new normal. Again, it's been a long journey we meet, and we come a long way in the way that we evolved through the pandemic.
Well, that was one of the things that we heard Mr. Shankar from the European panelists was adding where the companies that were running an observation process or behavior-based safety walk-arounds, whatever you want to call them. They were adding the health aspect or the health component to it. Dr. Wada, if I could, I'd just like to ask you a question. Over the last, I would say 10 years, you might want to qualify the time period maybe, but certainly what I've seen is that safety in the Middle East is now, if you will, at that deeper level. It's not just surface appearance, it's substance. Do you think that with this COVID crisis that the health component of health and safety will finally kind of get a equal priority with the leadership group in the Middle East? Or is this going to be the springboard for health to be taken a bit more like safety is definitely taken seriously by many leading companies for sure, but health has always been sort of the a bit of the stepchild, if you will. So do you think this is going to change things in the Middle East for us? Can you hear
It's a
me?
very good question. Yeah, I can hear you. Sorry,
Awesome.
I was on mute. Larry, that's a very good question. And let me tell you something that I'm, a lot of people, what they don't know about me, they might have heard me speak in mainly safety, kind of in a safety context, on operational excellence, and more recently in sustainability. But health was actually very much a priority for me many years ago. So what had happened, just to give you some background, many years ago I established the Occupational Health Services Center as part of the Occupational Health, if you like, function within the group. It was part of the HSC department. We had set up a clinic. This was back in 2006. I actually started the research into this about 2003, went around the world, spoke to a lot of people about occupational health. The whole idea was that, to create that kind of prevention, because I realized that we had a lot of employees, and a lot of the incidents that we were having probably were impacted by fatigue, impacted by other occupation health stresses that were underlying maybe the reasons for these incidents and happening. As you know, we operate in the Middle East. It's very hot over here, for example. So there's a lot of discussion about the accident rates that increase during the summer. Obviously heat stroke, heat stress, and all that is a problem, but actually the ability of workers to continue to work incident-free diminishes greatly, in sort of hot and humid climates.
Right.
But
right.
Back to your question in terms of health. So when we set up this function, today I think this function that was set up many years ago, which is now operating with 3 doctors, about 6 nurses, industrial hygienists, etc., was extremely critical. One of the reasons that Enoch, because we have a lot of staff accommodation. We have 11,000 employees. We have employees who are operating within, who are living within different staff accommodation. We have about 4 or 5 different staff accommodation, the largest of which houses more than 1,000 staff.
I want to get back and ask you about the contractors too, Dr. Wada, as well too. And then we've got all these questions coming in as well. I'll try to get to some of them, but go ahead. Finish.
Sure. I won't take long. So one of the most important things is our chief medical officer became sort of the chief incident advisor to the CEO, explaining to him and managing the situation. Went down to the actual re-engineered, our accommodation to make sure that we were able to create as much as possible the physical distancing which was required. We did the COVID testing. We started doing our own COVID testing within the group. And we were able to isolate the workers. So there was a lot of stuff. So back to your question, and lastly, yes, it's going to become very important. And I think that Mr. Shankar said something very important. He explained that we have more waves to come, and possibly other pandemics to come in the future. So I think it's going to be extremely important for organizations to have that as part of their incident response and crisis management and business continuity plans. It needs to feature very much in that. So yeah, definitely health is going to become important. But I still say what we need to educate leaders on is that prevention is really better than cure, and educating people, as Dr. Praveen said, actually educating people about their, personal hygiene. About it should be a way of life. Huh? I mean,
Yeah.
it should be really a way of life. I mean, we do an ablution at least 5 times a day, because every time we have to pray, we have to do ablution. So it's really part of that culture that we have here, also in the Middle East, that you need to keep. That's why water for us is the most precious resource. Anyway,
Well,
over to you.
Oh, no. Thank you for that. It's because living in Canada, we got more water than anybody knows what to do with, which is sort of an ironic thing. Dr. Praveen, I don't. You can dump this question off on either of the other panelists, but it came in, and I thought I maybe would just ask you. It says, from a mental health perspective, how are companies helping their employees and families battle the COVID pandemic? So I don't know if that's.
So
if you
actually,
want to talk.
Larry, I was about to include that mental health as part of health, actually. So you touched upon it. Thanks. So from JLL perspective, so we identified that mental health is very much crucial for this pandemic because of this lockdown, physical distancing or social distancing, what you want to call as. So it is having an impact on people's mental health. So what are we going to do about it? So our HR team, HR head, had come up with the solution of having partnering with a mental well-being institute, Santulan, and they are a call away from being the support which is required, which is crucial during any mental health related issues. So if I am not feeling well or I need to talk to someone, I just need to pick up my call and speak to them. So that's the support which our HR team had been given. And apart from that, we do have command center, as I already said. If they want to talk about illness, we are already there to guide them, support them. We also guide them towards that support services related to mental health.
Okay. All right. So did you do anything more like more outbound, more proactively, like sort of sending out, again, I know emails don't get read by everybody, but did you sort of sort of make sure everybody knows, here's the number, and and the other thing that I've tried to get across in the program we made about COVID and critical error reduction techniques is that even the experts make mistakes. So you shouldn't feel bad about if you think you made a mistake and you might have come in contact to speak up. Don't just hope you don't get one of your coworkers infected, right? Everybody makes mistakes. And that's what I try to feature in the program. Like, Anthony, who's been through 7 pandemics, he still made a mistake and almost forgot his PPE getting out of the limo at the press conference, which would have been really embarrassing, right? So I'm trying to hopefully get people freed up so that they're willing to talk if they do make a mistake too, or if they're having trouble to phone. We got another question, and Mr. Shankar, if you're up for it, it's how do you deal with complacency and the younger generation that are recommend dealing with younger people who are naturally feeling more complacent was the exact wording, but I've certainly seen a complacent isn't really the word for it here where I live. I would say that it's couldn't care less at all, not worried. They don't think they're going to get sick, and even if they do, they don't think they're going to die. So yeah, it's a bit of a hassle, but so what? Do you have any tips for the people? Because I keep trying to tell my kids and their friends, I said, you don't get to make decisions about older people and whether they get sick or die, you guys. That's not your right. That's just the way it is. Just like you don't get to smoke, around other people. Like they don't have to smoke if they don't want to. But that's just my kids, and they go, yeah, Dad. And so I'm not betting $1 million that I'm getting through to them. Are you guys doing anything at all for your younger workers to help them with complacency, Mr. Shankar?
I think your magnum opus, Boo Boo Bandits, would go a long way in capturing the hearts, minds, and souls of the younger generation. But having said that, I guess apart from other things that's done, you spoke about Fed leadership, Larry. It's also very similar.
I
If
should
the
wait my coloring book for everybody. You
Very
can get it off the
good.
Boo Boo Bandits website. That's right.
Ton of print to boot. So apart from audiovisual way of explaining why, I guess it's also important, the reason why we do what we do. And I guess a couple of the videos that we've shared on the social platforms and with kids also will go a long way in explaining how the virus spread, why the mask is required, why we need wipes, why we need to keep washing our hands and put it on the CV if you wish. But I guess felt really all about leading from the front, doing it yourself. When the younger generation, when the people see the leaders coming in, and I'm happy to see Dr. Vada using his mask. It's about actions. It's not just about the words. You might have all the precautions, all the rules, all across, all the signages. You could have all of that. But if you don't demonstrate it through actions, it won't work. So it helps both for the family, for the children, and for the younger generation. Practice what you preach. I think a ton of what you do will go a long way to creating millions of rewards there. So, and to avoid the complacency is about keeping on reinforcing. It's about keeping it start of the mind. We start every conversation with a safety pause. You can call it a health pause. A pause is planning and using safety every day to ensure it's always top of the mind. You never forget. You might get your hand to the face, but there's something that prompts you to avoid touching your fingers, your nose, and the ears. So it's about all of constant reinforcement.
Well, I know whenever I get on camera, I get a bit nervous and my nose runs, and I almost want to tell everybody, look, it's not COVID. I just get a bit nervous on camera. That's why I need the Kleenex. But it's still hard not touching your face. I found that the habit of coughing into my elbow was much easier to pick, to change that habit than to stop the other habits. And certainly, when we have you, like we've got a few minutes left and a few more questions. And Prabhakar, Mr. Prabhakar, or anybody actually, if you want to take a shot at it, there was a question about the masks. And hi, Larry. We made N95 or other homemade masks mandatory to use, but we have one conflict here. If the person is having medical conditions, asthma, what's the team comment? Is it advisable to use or not? Or what's an alternative mask? What's an alternative mask? So it's a fairly technical question, but from if somebody's got breathing problems, asthma or something like that, what have you guys been doing to accommodate them in terms of masks?
Dr. Vada?
Yeah, Dr. Water.
I just want
anybody who wants to take it. Really, I don't know who would.
Well, 2 points, Larry.
Nobody really wants to handle the mask thing. Even Anthony at Procter & Gamble goes, God, I've got a call every day from our C-suite about the masks. But he says, I think if when I look around the greater Ohio area, and he said, I see what the adults are doing with the masks. I have little faith that the children will be able to do much better. He said they'll do a bit better than the adults, he said, but not much better. So he's not a big fan of the masks for the kids. But what if, at the workplace, what if somebody does have trouble breathing? What can they do?
Well, the N95 masks, if you ask the medical practitioners, the chief medical officer, I have discussions with him, and he says, look, P95 masks are used by medical practitioners. They are really to prevent. If you're going to be in close contact with people who potentially have COVID or any other nasty virus or disease, then it protects them. So I've seen people go for a jog. I take a walk in the evening 5 days a week. Try to walk about 5 kilometers a night. And I see people running wearing a mask. I don't interfere, but I don't want to stop them, but and interfere, but they should not be running with a mask. The damage that you're causing for yourself. And there have been people who have collapsed because they've been wearing the mask. So the mask should be used for purpose. So P95, I'm not a medical practitioner, but the P95 mask, as far as I understand, for medical practitioners, should be used for that purpose. Using the normal mask,
even if they've got asthma and stuff like that, Dr. Watt, it's still, you can still breathe okay with it?
Well, the P95 mask obviously controls the amount of air that's coming in. So if you're doing any kind of exercise or even walking upstairs or walking for some distance, it's going to become very uncomfortable to wear the mask. Using a normal medical mask like the one I just showed you that I wear, this disposable one is probably, it's hygienic. You're not supposed to use it for more than 6 to 8 hours a day, and then if it sort of gets that, you should throw it away. You should definitely not reuse it. There's the other cloth-based masks which are P95 also, which are washable, that can be used. It's probably more sustainable to use those. But again, so the selection of masks, and people should understand that you use the mask. And my father wrote this satire play in Arabic, about this, and about this guy who sits in his house, and then even when he goes to sleep on his own, he wears a mask, kind of thing, So yeah, I mean, using masks, you use masks when you're in close proximity, to people, or you go into crowded areas. This is what I think. If you're doing exercise, you keep physically distant from other people, and you should allow yourself to breathe, because that's the whole point of the exercise. Just one last point I wanted to say, on the comment to Shankar's point. He's very, very right. The most important thing at the end of the day, and I've done a lot of work on operational excellence, as you know, Larry. The most important thing for success of operational excellence is operational discipline. It's about discipline at the end of the day. If people, and changing the hearts and minds of people, as you know, Larry, is the most important thing. If I'm convinced that I'm protecting myself and I am responsible, the government here in the UAE came up with a very nice motto in the last 4 weeks. When they opened up the lockdown, they said, listen, people can go out, keep the social distancing or whatever, do all the good things, wear the mask. But they said one thing: we are all responsible. You are responsible. So what you were just saying about your kids, we are all responsible. So safety has to become personal, right? And it will always be that way.
Well,
and that's how you're going to get operational.
Well, I agree. I mean, I ended, that's how I ended the program. I said, it's basic, like we're all counting on you. Everybody's counting on everybody to do their part. We don't have to do much, but we've all got to do it. We've all got to do our part, and it's a bit different. It's a bit different in terms of a social responsibility. It's not like a call to arms or something like that. This is a much different kind of social responsibility.
Sorry, Larry, just one last point. The amount of discipline that you get when you talk to adults and you talk to older people, right? And you sort of tell them you are responsible, this, and you educate them, is much, much better than locking them down and forcing them to do things, which makes them very, very depressed and then impacts on their mental health, like Dr. Pravina was saying, right? So it's much, much better that we all become responsible. We all step up to the plate, right? And that's what we need to do. So this is a good thing out of COVID in terms of changing the safety culture within organizations, in my mind, is that people now will feel personally responsible for not only their lives and their health, but the health of other people, including their families and elder people in the society. And we hold, in the Middle East, we hold, like in places in like India and the Indian subcontinent, we hold our elderly at great reverence, and we respect them and we love them very, very much, and we love to serve them and protect them. So I think it's been a good message, which has been very, very effective, I think, here in the Middle East for us. Thank you.
Okay. Well, no, and
Larry, yeah,
yes.
I would like to add on to, I fully agree with Dr. Vada. In every each of our communication, this is what we have been also insisting, that every individual, we are encouraging them, we are insisting, emphasizing that if you take care of yourself, then that's it. Actually, that is the most important thing. We also try to give in some, make them some emotional listing also, appeals, like we ask them, you have elderly people in your family, you have some people having some chronic illnesses in your family, your kids in your family. If you really love them, okay, then the most important thing you can do for them is take care of yourself. If you take care of yourself, then everything else will fall in line. That's what we do.
Yeah, and I believe also with something like this too, that people have to recognize that if we all say, if everybody says something, like, hey, just forget your mask, you don't have to say much, but if everybody does it, the person will put the mask on. Like, hardly anybody can deal with that level of social pressure and resistance, right? Just the other way, if the mass, the 2/3, whatever, of the people are not doing it, then it becomes a different, you being the one going against the wave becomes very difficult as well too, right? So, one of the things that I was just going to ask you, Mr. Prabhakar, and we've only kind of got, we're just about out of time, but how are you helping your employees deal with their families because of the 1 week link problem? I think what they're getting at is that one child to your child to you coming into work could be an outbreak, or it could be, we have to shut this operation down for a couple of weeks and clean it up, right? So how are you folks helping your employees deal with their families?
Yeah, as you rightly said, right, Larry, as you rightly said, this is a weak link, actually, or weakest link, I would say. Okay, because if your family members are not disciplined, or if your family members are not following all these, taking all these precautions, then there is every chance that then you can get that virus back into your office. Okay, so okay, unfortunately, for the families who are staying in their own homes, dispersed all over the cities, we have very little to do for them. Of course, we are doing few things like support in terms of medical guidance, and then arrangements with the hospitals and those things. Plus, we, as Dr. Prerna said, we also have tied up with one-to-one help that is available 24/7 for basically the mental health or for mental well-being of the employees and their families. It's available for everybody. Then for those living in our companies, colonies, or housing colonies, we have formed a group of volunteers, okay, who help these families in coordinating, uh, in ensuring the smooth supply of groceries, vegetables, fruits, medicines, all those things. Okay, our volunteers take care of all these needs for the colony residents. Fortunately for us, many of our employees and many of our locations, the employees and are staying in the colonies with the families. And for at least for those colonies, we have been doing a lot of things, right from having a medical facility, a doctor inside the colony. So in case any family member of the employee wants to consult the doctor is available. Then we have yeah, and our volunteers, they are coming to, they are giving a lot of support to these families, so that because now we are not allowing any maids, gardeners, drivers, all these people, we are not allowing them come into our colonies. And then these families, who, if they need, of course, essential things are required for everybody, right? Now, how do we meet that requirement? Then we have tied up with grocery suppliers, some departmental stores, some vegetable vendors and all. They deliver at one central location at the colony gate only. We don't even allow them to come inside. And our volunteers then call individuals and distribute with maintaining social distancing and everything.
Wow.
So that is the care they're taking. Yeah.
Wow. Okay. Well, that is really extensive. That's great. Doctors right in the community as well too. I mean, that's. I mean, it's maybe not something that everybody will be able to do, but it's certainly a great idea. I should also just say to everybody, they can also go watch the booboo-bandits.com, and there's a Ouchbusters versus COVID coloring book that they can download. Guys, that we are out of time, and I got a few more questions. I would also really like to have you back in 2 weeks, and we can have just the next session is on the leading indicators. What do you really believe in? What's reliable, and what would make you change the course of the ship? And that is going to be on, I think, July the, leading indicators July 2nd at the same time in the Middle East, India. And then we're going to, 2 weeks after that, we're going to do zero harm, yes or no. And then 2 weeks after that, we're going to talk about felt leadership and are the employees feeling it? So hopefully you can all join us for the next one, but we maybe have just a bit of an update on COVID from each of you just before we get into the leading indicators, because things are changing all the time, and there might be a few more issues in terms of complacency or a rebound that are a little more timely. I mean, the leading indicators thing's been around for 30 years. I don't want to start saying how long I've been in the safety business, but it's getting awful close to 30 years. And I've been hearing people whine about reliable leading indicators and why we can't use lagging indicators. And it's still 30 years later, and I'm not sure we've come that much further. So I think everybody really like to know what you guys really believe in and what would make you change the course of the ship. But like I said, before we get into that, maybe just a bit of an update from each of you on how things are going with COVID, and hopefully you'll have some good news and that things are continuing along. It sounds like each of you and your companies are managing things quite well right now in terms of number of outbreaks, things like that. Let's hope everything stays the same way for the next 2 weeks. And thank you all very much for your time and for your answers. And I could talk to you guys for hours. So, but we got to let everybody go. And for those of you listening, thanks very much again for attending. If any of your colleagues couldn't attend, again, we will get the recording out to them 24, 48 hours. And we're going to make sure for the next one that we've got lots of room for everybody. I should have known better with India, but thank you all very much, and hopefully we'll see you all again in 2 weeks. Okay, bye-bye.
Thank you, Larry. And the good news is there is
Thanks, Larry.
come in. That is the end of all the good news. Dexamethoxone in. Hopefully that will